Once your system has been properly configured and each authorized provider has been successfully activated through the logical access control process, EPCS functionality will be available for you to e-prescribe controlled substances within Office Practicum. The most significant change to Office Practicum with respect to EPCS is the signing screen and incorporation of two-factor authentication. The DEA requires that all controlled substances being transmitted electronically be authorized using two-factor authentication, which requires a user to enter two different variables, one thing you have and one thing you know. A similar process has been universally implemented with ATM machines, where a person will enter their ATM card, the thing they have, and their PIN, the thing they know. In the case of EPCS, the thing you have is a hard or soft token and the rotating PIN number associated with it, while the thing you know is your passphrase. So how does two-factor authentication work for EPCS inside Office Practicum? Let's prescribe a controlled substance. Note that for Schedule II drugs, 0 refills are allowed. However, up to 5 refills are allowed for Schedule 3 through 5 substances. The system will automatically know that you have selected a controlled substance. Notice that there is a hyperlink here entitled PMP Tracking. Some states offer a prescription monitoring program, or PMP, where providers may check the fill history of a patient. In fact, some states, such as New York, require this check be done. Through System Setup, the hyperlink to your state's PMP program can be configured. Please view the EPCS System Setup and User Management video for more information. Notice that if I click on the link, a new window will open, bringing me to the URL that has been configured. From here, you can log into your state's PMP. We have also added a field where you may enter a confirmation number or some other note pertaining to your search. Let's go ahead and send this prescription. Note that controlled substances can only be successfully transmitted to pharmacies which are enabled for EPCS. When selecting a pharmacy, notice that OP will indicate as to whether the pharmacy will accept prescriptions for controlled substances electronically. Furthermore, you may search for EPCS pharmacies only. Let's go ahead and transmit this prescription to a pharmacy by clicking Send. A summary will be presented as usual. However, once I click Send here, the EPCS signing screen will open. The provider must confirm sending this prescription by checking the box on the left side of the medication name. Next, select the desired token. Note that the system will default to the last token used. To complete the process, enter your passphrase and the PIN from your token. Click Sign and Send. The prescription will enter a pending status until confirmation is received. If we go to the e-prescribing center, we can see that a new tab has been added labeled Pending EPCS. Note, if you exit from the two-factor authentication screen without completing two-factor authentication, the prescription will be created in Office Practicum but remain in a pending status. Going back to the medication list, users will not be able to edit prescriptions for controlled substances which have been transmitted or printed previously. Controlled substances can only be transmitted or printed for dispensing once. Therefore, some restrictions have been placed on printing prescriptions as per DEA regulations. Users may print a medication for dispensing if the prescription has not been previously transmitted or printed before. For example, if I try to print the prescription we just sent, a watermark will be placed on the printed prescription indicating it is a copy and not valid for dispensing. Refill requests for controlled substances are processed in much the same way. The system will recognize that the medication being approved is a controlled substance and automatically present you with the EPCS signing screen. As with the previous example, simply select the medication and enter the necessary information for two-factor authentication. This will enable a successful response to the refill request. Certain drugs used for narcotics addiction require providers to have a narcotics addiction DEA number or NADIN. In such cases, after I click Send, when a medication is selected which requires the prescriber to have a NADIN, such as Suboxone, the system will recognize that and present the provider with the NADIN field here. Based on your system setup, the NADIN issued to you should already be pre-populated. However, if it is not, you may enter it here. A NADIN number is 9 characters long, starting with 2 letters and ending with 7 numbers. Once the NADIN has been verified or entered, click Send. Then follow the EPCS signing process with two-factor authentication as with any other controlled substance. A second special circumstance is when a drug is prescribed which contains GHB or gamma hydroxybutyric acid, such as Xyrem. In this case, after I hit Send, the medical necessity must be documented for the pharmacist to fill the prescription. We have allocated a specific field for that reason to be documented. At least 5 characters must be entered. Next, click Send, then follow the EPCS signing process with two-factor authentication, as with any other controlled substance. Thank you for viewing this training video. If you have any questions, please contact a support representative.